Okay, hi. It's been a while. Sorry, and I'm going to tell you why in a minute. But that's part of the reason why I'm doing this. And another part, well, let me just get right into it because I ended up last time doing a 6-minute video, so that's why I have to reshoot this. But I've been gone because I've had gallbladder issues. I went to see a surgeon, and the surgeon said, go get this test done. That's the first part of what he said. Go get this test done. So, I'd already been in the emergency room twice because I'd had these really bad pains and something just wasn't right. I'd gotten to the point where I was eating every other day because it hurt so bad to eat. So I'd take my piece of paper and I'd go to the hospital and I hand them my piece of paper. It says the doctor wants me to take this test, and they say, we're not going to let you have it because you owe us too much money. Well, I owe them too much money because I don't have insurance, and I had to be in the emergency room twice because of this bad pain I was having. So basically I threw a fit. They said, okay, you can have this test done, but we're not going to let you have anything else done until you pay us the money that you owe us. And so I said, okay. I get the test done. Of course, it shows I need surgery. So then what do? I either have to pay them the $3,000, no, I think it was more than, I think it was $7,973 or something is what all these tests and visits cost me about my gallbladder, okay? Or I had to pay the $15,000 for the surgery, or they weren't going to let me have it there. And I work, but I'm a contract employee. Nobody wants to give me a loan. And I have no health insurance, and I didn't know what to do. So I did the only thing I knew to do, which was to get online and to email every single elected official I could find. Governors, senators, local and state. I did not know we had state senators, people. This is, I know I'm going to sound ignorant, but that was education for me. Congressmen, Attorney General, everybody. I mean, anybody who was associated with the state, I sent emails to, okay? And, 90% passed the buck to the next guy, right across the board. You need to tell this guy. Well, I did tell this guy. He told me to tell you. It just, to me, really opened my eyes about what a sorry situation our health care coverage is in this country. We're supposedly one of the richest countries in the world, and it's laughable. To me, it's laughable because I lived through it. If I hadn't, then, I was fully prepared, told my kids, sue the hospital. If mommy dies, sue the hospital. At least then they're covered for college, right? But, it got to the point where I was so ill, I didn't know what to do. I was calling these people every day crying, saying, please help me, and nobody would help me. Finally, I got my local senator to place a call to the hospital for me and say, she applied for financial aid through you because you can apply for financial aid through your hospital. And you have all our information. They said it's going to take 30 to 60 days for a decision, but why can't I just get the procedure done in the meantime? If they decide that, I don't qualify for it, I'm under their guidelines. They pretty much already knew, but it's a formality, and it takes 30 to 60 days for a committee to hear, my case and to decide, right? So I had the surgery. A day after he called, they called me and said, you can have the surgery. So I had the surgery done, and sorry for the gross nature of this. I'm sorry, don't want to offend any of the squeamish people, but it ended up being my gallbladder was being strangled by my stomach. My stomach was actually grown attached to it and wrapped around it, and that's why I'd been having so much pain. And it was a necessary procedure. I mean, I really could have died because I couldn't eat, and nothing was going through there the way it was supposed to. So, to me, it just proved to me that we need a change in this country, okay? I'm not going to get on a soapbox and tell you what to think and what to feel. But now's when they start saying where they stand on issues. And every single one of us knows someone that's or underinsured. We have a relative, a friend, family member of some sort that can't get the health coverage that they need, or have coverage and yet it doesn't cover everything that they need. And that's a problem to me, when we're the richest nation, or when we're the richest country, and yet we can't afford to take care of our own people. And that's not to take away from, foreign policy or whatever. I don't want anybody getting mad at me. The war, I'm not anti-war. I'm not, so I'm not even going to tell you where I stand on the war or, the troops. Of course, I support our men and women. My problem is, we also need to look inward and take care of our own people. And that's where I think our problem lies right now. And some people are going to disagree, and that's fine. But for the people like me, maybe all I'm saying is maybe that the next person that goes through what I did won't know what to do, and we'll wait till it's too late, and we'll die from something that could have been fixed. So that's why I'm just saying, with the upcoming election, pay attention, listen to where the candidates stand on healthcare reform, and if they don't say, ask them, because we need a change, and it needs to happen soon. And thank you all for listening. Love you all, and talk to y'all soon.